stem cell injections are actually a very exciting growing field right now in orthopedics and pain management. And basically what we've learned is that, through years and years of science is that all human cells start very close to each other, very like a few different lineages, about 3 to 5. And then they differentiate to the more complex cells that we know based on the surrounding cell structure. So we're able to kind of start harnessing that science and basically put in very early on stem cells and then put them near structures that have been damaged, and then we see them turn into those structures and regenerate. So it's called regenerative medicine, and it's just a fascinating field that's just growing, and we're only in its infancy right now. So you're going to see that stem cells and regenerative medicine become a more common practice as the years go on, and we're able to harness that science even better. But right now, yeah, we see some great results with stem cells. I've been doing them for many years, especially when we're talking about rotator cuff injuries, meniscal tears, cartilage tears, things of that nature. They do have their limitations right now as far as what they can do, but I think you're just going to start seeing this more and more. So it's definitely, stem cells can be taken from other people. So it can be amniotic fluid, placental, fetal, and then they can also be taken from yourself, actually. You have your own stem cells that we can harvest from bone marrow, from fat cells, and from your blood. So it's just, like I said, it's a fascinating field, and you're just going to hear more and more about it.
Great. And then why is my pain management doctor referring me for physical therapy or chiropractic care?
So pain management is only a component of the team when we're trying to deal with work injuries and car accidents, right? So as the name implies, our role is to help kind of manage the pain. But a lot of the things, that occur, a lot of the injuries that I kind of even discussed before, sprains and strains, tears, ligament things, they come with some limitations, and they can limit your mobility. They can cause some weakness. They can cause some alignment issues in the body. So then your knee hurts. So then your back starts being thrown off and gets, and then you start having back pain and things like that. So while our job is to control that pain, bring it down, identify what's going on and what's wrong, right? A big part of that team to help recover and repair those injuries are the therapists that we rely on. So physical therapy and chiropractic care, that type of therapy requires typically, you going 2 to 3 times a week for 8 weeks. So it's a lot more hard work and grunt that the patient needs to do, and they need to be, monitored closely by another physician to do it. Unfortunately, as pain management doctors, we're not capable of that type of care. So we rely on our partners, on our physical therapists and chiropractors too. Chiropractors are amazing at getting that alignment back and getting that inflammation out of the back pain, the neck pain, and all that. And our therapists, they work on strength training, range of motion issues. So, and sometimes you might actually be referred to both a physical therapist and a chiropractor, depending on what injuries you've sustained. But they're an essential part of the team. And just like we have orthopedic surgeons that sit there and do surgeries, we have the therapists that sit there. And then for the majority of people, they will fix the problem. And that's why we need them.
Got it. And then the last one, why is it so important to basically see a doctor who understands and has experience treating and documenting both car accident injuries and work injuries?
Yeah, so this is extremely important. While a lot of people are inclined to go see their primary care right after an injury or an accident, and their primary care, obviously knows them very well and has their best interests in mind. Unfortunately, when it comes to accidents and work injuries, navigating the insurance, has become a kind of a difficult part in practicing medicine all around, commercial insurance, Medicare, but even more so important in work-related accidents and injuries, because if you don't document specifically what happened, and then later on this ends up going to litigation or something like that, they're going to look at this as if your primary care didn't document that your injuries resulted from an accident, they're going to look at this as a pre-existing condition, and it could be pretty detrimental to you getting the care that you need. It can delay it for months, for years. So it's extremely important to see somebody that's kind of used to the nuances and navigating these insurance companies to make sure that the patient, gets not only the care that they want, but in a timely fashion, because that's probably one of the most important factors we see for outcome of patients is how quick to the time of treatment they get, which will dramatically increase their prognosis.
Great. Perfect. Thanks a lot, Doc. I appreciate it. I will chop these up. Do you want the raw footage or no?
No. I just basically whatever you post, I love just copying, sharing that on my stories, and that's the easiest way for me to do it.
Perfect. We'll do that. I really appreciate it. Have a great week.
Awesome. Thanks, buddy. You take it easy.
Bye.